My uncle's been on the service for about 8 years, and I've always admired that. I've wanted to do it for a long time, but now is the time.
My brother was in a bad accident when he was younger, and we lived way out in the country, and it took a long time for someone to respond, and that first made me interested in becoming an EMT.
Bayfield and Ashland counties are currently facing a healthcare crisis. Local emergency medical services can't recruit and retain enough EMTs to keep up with the need. If we can't interest more people in becoming EMTs in our counties, services could be reduced, response time could go up, and people could be in danger of not receiving the emergency medical care they may need.
I guess, to me, I hear a lot of people say, I could never do that. But when you go through the training, if you have compassion, and there are so many compassionate people out there, and they're so concerned about not being able to handle situations, but when you go through the training, you're taught how to handle those situations. So when you get on the scene, you're ready.
I know when I was thinking about it, a lot of people in my life said, you're too sensitive, you know, there's a lot of, you just wouldn't be able to handle it, and that's far from the truth. I think that, like I said, bad things are going to happen whether I'm an EMT or not, but I feel a confidence knowing that I can make a difference and I know what to do when that bad thing happens.
I've had an incident to where I was pretty shook up and upset after I left, and I did have an EMT, a fellow member. She went outside and talked to me and kind of calmed me down and, you know, really helped me out.
Hello, my name is Bob Paulus, and I have many reasons to respect emergency medical technicians and all first responders. I have had a 40-year career in law enforcement, first as a Wisconsin State Trooper and more recently as Sheriff of Bayfield County. Past November, while hunting in Bayfield County, I became involved in a life-threatening accident. Local emergency medical technicians and firefighters quickly stabilized me and carefully transported me out of the woods. The doctor said I was very lucky to have survived. I sincerely believe that had it not been for the quick response and the care that was given to me by these emergency medical technicians, that I would not be here talking to you today.
One of those things, the pager goes off, you get the call, you hear what there is, and your mind starts prioritizing what needs to be done and who needs to do what. And as you start out, you get there and put all those things into place and make sure that it's the way it's supposed to go, and if it's not, you pull the pieces and make it fit and go from there.
It's one of those things that new people in EMS really want to know, what's that pattern, what's that key, what do I do? And it's something you just kind of learn. It's a comfort level that you gain over time in different calls of knowing this is how this call is going to go.
But you try to set the tone to how the situation, you know, you try to keep calm because then the patient stays calm. You know, sometimes you're just screaming inside because you're nervous, but you have to put the calm face on and just be reassuring. Sometimes that's all that's needed, is a reassuring voice.
But it's just sometimes just being there, providing our service, getting them to the hospital where they need to be. That's kind of what keeps me going day to day.
The team aspect is wonderful. I mean, you work with just a super bunch of people. You all work together well, and you get to know a lot of nice people and a lot of good friends.
A lot of fun. It's a lot of neat stuff, you know, the excitement, the aftermath when something really goes well and everything comes together and you really have made a difference and help someone.
I think it's a rewarding experience. You can feel good when somebody turns around and says thank you.
Being able to help people, but also the excitement of being part of something, of being part of helping others.
I would tell you it is going to be the most empowering thing that you can do. You're going to feel different about yourself, especially in an emergency.
You know, somebody comes back and says, boy, thanks a lot for doing what you do. And I think that's good enough.
No call, you go on as the same. It's very rewarding. You have when things turn out right, you get a smile. Makes you feel good that you did something.
You know, I honestly, you know, kind of the nice thing about this profession is you don't necessarily have to jump in with both feet. You can get your feet wet before you dive in head first. And if you're unsure, you know, come with us, take a ride along, you know, do and see what we do on a day-to-day basis at times.
No one should feel uncomfortable asking, hey, can I join your service? Because we welcome everyone and we help you through your training, and you will never regret it.
If you truly want to do something for your community and you're looking for something to do, this is the thing to do. Yeah, there's a commitment involved, there's some time involved, but I don't think you're going to find a much more rewarding choice.
Go for it. It's very, it's interesting, it's rewarding. It's a whole different world out there being an EMT, and
it's a really serious job. You have to want to do it, but it's so rewarding. You know, even the training and the togetherness of the crew.
Just do it. Really, it seems like a big jump, a big move, and all this kind of stuff, but it's really rewarding. It's worth doing. Really, like Nike says, just do it. You won't regret it.
Well, it's an ongoing need. Basically, in any type of service, people attrition. They get older for various reasons. They don't want to do it anymore. So you always need fresh people coming in, people who are interested, people who primarily are willing to help other people.
You know, you meet somebody in the worst 20 minutes of their lives, and hopefully you can make it a lot better for them, or at least get them to where somebody can make it better for them. And I guess that's what keeps me going.
It's a great starting point because it can lead to so many different opportunities, and it's a great way of just helping your community, helping your neighbors.
It can be the most basic call, and when we're leaving the hospital and the person says, you guys are just wonderful, it makes it worth it.
It's professional. People are there for the patient. The patient is our #1 priority. And you couldn't have a better group of people. We might be goofballs when you see us other places and things like that, but when the pager goes off, we're business.
We had 2 ambulances going to the scene. 1 ambulance without the snowmobile, another ambulance with the snowmobile on the back. The first ambulance without the snowmobile showed up, and sorry, we got a call. We're gonna have to take off. I'm in.